Another strike, this time more than 17,000 ambulance workers, affecting most of England and Wales. The third time in 5 weeks they've been out on picket lines, and in all likelihood, they think not the last.
I finished at 8:30 and then I've been to bed and I'm now here.
Just off a weekend of night shifts, Scott McCautry is a paramedic in Greater Manchester. During breaks, he recorded video updates for us.
So it's 1:10 on Monday morning. We've had a couple of jobs this evening where we've been stuck on the corridor at our local hospital. A couple of hours on the corridor with each patient.
We met up with him today as he joined his colleagues on the picket line in Altrincham after a 12-hour night shift that ended up being 14 hours. What's the job like at the moment?
It's not good. It's not good. We do the job for our patients. Our patients are the priority. That's what we do it for. And the patients aren't getting the quality of care that we want to give them. You go home thinking, have I done my best today? And we know we haven't.
Straightforwardly, this is a strike about pay. And yet, talking to people on picket lines, it's clear, for many, it's not that simple. In Liverpool, another picket, and more ambulance workers who say things of late have been worse than they've ever known it, and that the mismatch between inflation and pay is pushing people out of the job, making things even more stretched.
This is about, the conditions that we're working in, the hours on end that we're standing in corridors, the sick patients that we're just apologising to them and the family for being laid on the floor for 12 hours. It's just horrendous. If it was my parents waiting for an ambulance at the moment, I know they wouldn't get the response that they deserve and they should get.
With more strikes coming, including 2 weeks today on February the 6th, what may well be the biggest day of strikes in the history of the health service. But right now, an agreement between the unions and the government does not seem imminent. The General Secretary of Unite suggested a 10% pay offer may well bring the dispute to an end, and today called for direct talks with the Prime Minister.
Rishi Sunak is literally missing in action. Where is he? Why is he not taking responsibility for this dispute? He needs to come back to the negotiating table. Stephen Barclay clearly has no authority. Rishi Sunak is the core decision maker. He needs to come back to the negotiating table, get this sorted out. He's the leader of the country, so these people can go back to work.
Those calls for Rishi Sunak to get personally involved and the claims that he's been in hiding responded to with a visit to NHS mental health services in Northampton, but insisting, again, that meeting the union's demands would not be the right thing to do.
Where's the money going to come from? And, actually it's probably going to have to come from elsewhere in the NHS budget. It would be lovely to be able to wave a magic wand and just give everyone what they were demanding when it came to pay. But, my job as Prime Minister is to make the right decisions for the country.
Outside a newly opened, state-of-the-art Liverpool Royal, some ambulances were coming and going. As on previous strike days, an agreement remains in place to staff life-threatening call-outs. And so far, in many places, the number of calls today seems to have been significantly down. But in Liverpool, it wasn't just paramedics on picket lines. Here, there are nurses, porters and midwives with 5,000 hospital staff in all on strike today. The kind of widespread walkout that many more places and many more people are due to experience next month.
Well, earlier I spoke to the lead health negotiator for the Unison Union, Sarah Gorton, and I began by asking her what her union and the others involved in the current dispute want to hear from the Health Secretary, Steve Barclay.
We've been really, really clear with the Secretary of State that what he needs to do is secure a commitment from the Chancellor to boost pay for the current pay year, as well as just talking about pay from April onwards. So the health service needs more staff if it's to get through the current workforce emergency. And one of the main reasons why people are leaving is for better paid and less stressful work elsewhere.
The reality is the strike action is only making the situation in the NHS much worse.
So firstly, it's difficult to see how the strike action could make the worst situation in the NHS's history could be treated as if it's responsible for that. So the hope of everybody that's taking strike action today and on the previous 2 days is that the fact that they are prepared to stand up for themselves, for the services that they care about and the patients they want to be able to look after much better, is that by calling attention to the dire state of the NHS, that they concentrate minds and people fix it.
But you do have to accept that strike action is having an impact. NHS data suggests thousands and thousands of patients' appointments are being hit by these strikes. We hear all the time of people waiting hours and hours for ambulances. How do you square that with the public? What do you say to the public about that?
Strikes have to have an impact for them to achieve the focus from the government that we want them to have. So what we've been, the situation that you see, every single day care is being compromised, and to pretend that it is the strikes that have been doing this, when actually that's the situation that has led people behind me to be to want to stand on picket lines in freezing cold weather to try and challenge that situation. We are seeing across the board a workforce emergency.
Is the calculation you're making that this is a question of who blinks first? The government may make the judgment that if they settle with one union or one sector, they'd have to settle with everybody, and they simply can't afford to do this. If that is the case, how much longer do you think these strikes can go on?
We think there is a really strong economic argument for investing in the NHS. The economy needs people to be well in order for it to function. At the moment, the ONS reported late last year, we've got half a million people who are considered economically inactive because they're waiting for treatment. So investing in the NHS is good, not just to get the NHS back on its feet, but for the whole economy.
You'll be aware of voices saying, the NHS is functioning so poorly that maybe it is time to look at the whole way it works as a model and much more intervention from the private sector. Do you worry at all that the strikes contribute to that argument in any way?
I think if we hadn't got such a comprehensive set of data to show us, firstly, what the NHS looked like when it was properly funded, hitting targets, in ambulance services, being confident about every Cat 1 call being responded to in 7 minutes, handover times limited to 15 minutes at most calls. It is the funding and the staffing situation that's contributed to the kind of figures that you see now about call response times. So to pretend that this is easy to fix by going elsewhere to the private sector, I think is to underplay both the complexity of the NHS, but also the fact that they haven't actually tried the basic steps to fix it, of investing in the workforce, starting with a boost to pay.
Sarah Gorton, got to leave it there, but thank you very much for talking to us.
Thank you.